Thank you, Danielle. All right, you probably saw my mouth moving. I was telling my kids to stay in the hallway. All right, our results. This graphic shows the process for our work. This and other beautiful charts presented in this section of our work were produced by Dr. Amina Leo, who unfortunately was unable to join us today. From December 2019 to January 2020, we worked on recruitment of listening session facilitators and training of those facilitators. We conducted 5 listening sessions between January and February 2020 in local community centers across the city. From March 2020 to April 2020, the consortium reviewed the data and analysis and developed research questions. Most of that was done remotely for reasons we're all aware of. We used lots of Zoom calls. The qualitative analysis process was conducted by researcher members of the consortium and identified themes from the listening sessions. The preliminary themes were then presented to the consortium. As Danielle mentioned, we added a listening session for fathers, which provided additional validation. The analysis was revised based on feedback from the consortium and then validated by consortium members and mothers through survey and focus groups. The factors were then ranked for future research. Our project engaged 44 Black mothers over 5 listening sessions. Mothers' ages ranged from 18 to 43 with a mean age of 30. There was an average of 2 children per mom and an average of 2.7 pregnancies. The education of the mothers were diverse, with many having at least some college. The mothers were from 19 zip codes in the Rochester area, and these zip codes had varying incomes. Now, more about what we learned from the moms. Mothers' positive experiences included, at the mother's level, feeling prepared, informed about processes and what to expect. At the interpersonal level, having the infant's father's support and engagement, as well as having social support from community organizations. And at the clinical staff level, supportive midwives, physicians, and lactation consultants, as well as feeling involved in the decision-making about birth and delivery. Mothers' negative experiences included at the mother's level, having little knowledge of the process and expectations, and the presence of pre-existing emotional and mental health conditions that had not yet been addressed. At the interpersonal level, there was a lack of support and engagement from fathers, as well as lack of social connection to peers. At the clinical staff level, mothers said that they felt discriminated against due to skin color, country of origin, insurance type, and religion. Mothers also said they had the providers had little knowledge of the communities they came from, and they didn't feel that providers were listening to them. Mothers weren't feeling like they were included in decision-making processes. At the healthcare system level, mothers stated that they had no continuous relationship with the clinical staff and that there were no providers of color. At the institutional level, mothers stated that they had unsupportive work policies and a lot of financial burden. The summary of information is helpful. However, our interactions in rooms filled with Black mothers were powerful, and these quotes really bring to life what we learned and some of what our experiences were. One mom shared, "I wanted a natural birth. I was given an epidural without information or by consent." I'm going to pause here because it's important to point out that our consortium was made up of Black moms who acted as facilitators and Black moms who were there in other capacities. The group also had clinicians and researchers, and we went over so much detail, including these points and many others. A lot of times people said, "I don't believe that happened," but what we learned from moms really forced people to think differently and forced us to engage in some really difficult conversations. So as much as I feel this gives it life, I wish you could have all been a fly on the wall during those consortium meetings. And I think my colleagues would agree that we learned a lot about each other in this process. Another mom reported, "I was moved to the room in the back, away from all the other mothers, probably because I'm Muslim." And stop here. We had a listening session that was with moms who were refugees, and a lot of those moms were Muslim and wore traditional garb. And it was really hard to hear this, but so important that we had these dialogues. Another mom stated, "I wanted a water birth. I had my birthing plan, but he ignored it. I gave birth in the hospital." I felt like they were pushing me to have a C-section because I think they get more money for it. I think someone's line is unmuted, sorry. They kept talking about abortion, even though I kept telling them I didn't want one. I finally switched to a Black provider who understood me and worked with me to start treating my son in utero. That mom was a really interesting mom. Her son had a congenital disorder and she refused to abort him. She kept hearing the same thing over and over from providers, and she switched to a doctor that supported her decision. She's since moved on to advocate for the condition that her son has across the country. She's really active supporting the other mothers like herself who choose to have their children despite this condition. This graphic shows how the supportive factors or positive experiences and the maternal stressors or negative experiences line up across broader categories. Both supports and stressors were present at the mother's level, interpersonal level, and the clinical staff level. However, only stressors were present in our data for the healthcare system and institutional levels. All levels aggregated to areas affecting the pregnancy experience as shown in this graphic. Mother's level impacted, mother-provider communication and emotional and mental health. The interpersonal level impacted social support and emotional and mental health. The clinical staff level impacted mother-provider communication and emotional and mental health. The healthcare system level impacted mother-provider communication and emotional and mental health. And the institutional level impacted emotional and mental health. Emotional and mental health and social support interacted with each other, or impacted each other rather, bidirectionally. The mothers who attended sessions and the consortium provided feedback on the factors to rank them in order of importance for the next steps in this work. Number 1 is mother-provider communication. Number 2 is emotional and mental health. And number 3 is social support. So for conclusions and next steps, based on our listening sessions with Black moms in Rochester, mother-provider communication is an important factor affecting Black mothers' experiences with perinatal care, healthcare. Mother-provider communication is affected by maternal health literacy, provider-clinician racial bias and cultural bias, as well as discriminatory actions. Mother's mental health and emotional well-being is affected by or exacerbated by these experiences. The consortium is moving forward with plans for research on and implementation of interventions to improve mother-provider cross-cultural communication and relationship building. Finally, none of this work would have been possible without the PCORI grant secured by Healthy Baby Network. Working with their executive director, Sharita Bullock, and others in this organization have helped to bring this work to fruition, and it has been amazing. The Black mothers and fathers who participated in the listening sessions have been so gracious with their time and stories, and for that, we will be forever grateful. And finally, the consortium full of incredible and talented mothers who wear many hats professionally and in the community. Clinicians, researchers, maternal-child health experts, and doulas were a joy to work with, and I'm glad to still be a volunteer with the consortium in my new role as Executive Director at HealthConnect 1. And with that, we will open up for questions, and the colleagues over at UIC and Kay will help to facilitate those questions. Thank you.